It's really interesting to me that of all the great advances that we've had in cosmetic surgery over the last couple of decades, one of the ones that is the most exciting is the way that we handle patients during the surgical recovery and in preparation for surgery to really make the recovery better. We have better pain medications than we've ever had. We have better anesthesia options than we've ever had. And we've really learned to integrate a lot of lessons from other specialties in terms of using non-narcotic medications to really help the recovery move along well. So there's several things that we can do ahead of surgery to help with your recovery. This includes optimizing your nutrition. We'll check and see what kind of vitamins and supplements that you're on. Some of these need to be stopped, and others we may continue. Another thing that we do now is we actually provide some medications that start ahead of your surgery to really help afterwards. And so an example of that is gabapentin. It's a medicine that was originally used for seizures, but it's shown to actually help in pain control and to improve the effect of other pain medications. We also may start a non-steroidal such as ibuprofen early on, or even Celebrex to help. All these together help reduce your post-operative narcotic load. Once we get into the operating room, there's several things that we'll do and our anesthesia team will do to help. These include the type of medications that they give, things that they give you to help prevent the development of any nausea after surgery. And one of the big things that we have now is long-lasting local anesthetic medications. Now this is called Exparel is the name of this. It's not for every procedure or every anatomical location, but when it is an appropriate location, it can really be a godsend. So for instance, in tummy tucks, which historically many years ago were one of our most difficult operations to recover from, we now have a percentage of our patients that don't need any narcotic medications at all. And in fact, the amount of medications that people take is reduced by over 50%. And that's with them more comfortable and more able to walk around. All that kind of lends toward patient safety. So post-operatively, there have been a lot of changes as well. One of those is that now we use a lot of non-narcotic medications to supplement or perhaps even eliminate the need for narcotics after surgery. Now, everybody's aware of problems with narcotic overuse, but what we really realized, and we've learned this from other specialties, as you use these other medications, you not only limit the amount of narcotic, but you also have a better recovery. It helps you be up and more active. And years ago, they used to say, be still, don't move. We now know that's part of being safe and having a quicker recovery is to get up and mobilize well. We'll continue some of these medications afterwards, those like we mentioned, like Celebrex, or the gabapentin that we mentioned beforehand. We can continue those after to help with your recovery. So it's really exciting when we have patients come back and they said, I only needed 3 or 5 pain tablets, or I didn't require any narcotic tablets at all. It's there for you if you need it, but we want to be good stewards and we want to be safe of how we use that.